Perform hand hygiene and provide privacy for patient. Confirm provider order or facility protocol for frequency of dressing change. Gather the required materials for the procedure. Sterile drape, gloves, masks, biobag, sterile gloves, absorbent pad, 2-chlorhexidine swabs, split sponge dressing, 4x4 gauze, microfoam tape and tape, pair of scissors and marker. Provide a clear explanation of the procedure to ensure patient understanding and cooperation. Elevate the bed to maintain proper body mechanics. Position the patient supine by lowering the head of the bed. After assembling the necessary supplies and preparing the patient, don a mask and clean gloves. Gently position the patient onto the unaffected side and place a protective chucks pad beneath the insertion site to maintain a clean working field. Gently remove the old dressing, supporting the chest tube to avoid accidental dislodgement. Assess insertion site for any abnormalities including redness, swelling, pain, sub-Q emphysema, and excess or unusual drainage. Discard the soiled dressing and gloves in a biohazard receptacle. Remove gloves and perform hand hygiene thoroughly. Establish a sterile field, arranging the sterile drape and necessary supplies using aseptic technique. Proceed to don sterile gloves, maintaining strict sterility throughout the process. Maintaining the integrity of the sterile field, cleanse the insertion site with a chlorhexidine applicator, using a cleaning motion that begins at the insertion point and progresses outward. With a second applicator, carefully clean along the external surface of the chest tube itself. Ensure the antiseptic solution is allowed to air dry completely before proceeding. If ordered, gently place sterile petroleum gauze around the insertion site, ensuring a complete occlusive seal. Position sterile 4x4 gauze or a pre-slit drain sponge securely around the chest tube to provide additional protection. Cover the site with a sterile occlusive or transparent dressing in accordance with facility policy, carefully smoothing the edges to maintain an airtight seal. Stabilize the tubing from the insertion site to the drainage atrium by securing it with tape, thereby minimizing the risk of accidental disconnection. Secure the chest tube by anchoring it with tape to the patient, ensuring stability and reducing the risk of traction or disconnection.
Yeah.
But then, like, if it yanks, it only pulls here and not here. So that's the thing.
Label the dressing with your initials, the date, and the time of application. Perform an assessment of the patient's respiratory status, overall comfort, and the functionality of the chest drainage system. Complete documentation, noting the appearance of the insertion site and the type of dressing applied,